The District Health Board decided to get involved in the health literacy review as a way of improving outcomes for people with long-term conditions. And diabetes was chosen because of such a burden of disease in the Northland population. Health literacy is definitely about the systems and processes of health professionals and health service providers, the service itself. It's not about patients as their responsibility. It's about the way we configure and deliver the services to patients that is critical. And that is what we've learnt from being part of this project.
The benefits for us were that we had identified within our strategic planning that communication with our patients was key. And so an opportunity to be involved in health literacy research was very much aligned to what we were wanting to do.
We were interested because we just saw it as being a very kind of obvious but novel way of looking at improving patient care. Because we took part in this review, which was really useful in itself, it made you start to think about other aspects of the care and the team. It made us think about the whole way we communicate and give people reminders of what they're taking. And it's given us some simple ideas that we know we can improve with our medication record, but in terms of the information in the various forms we give to the patient. The obvious areas are patients with diabetes, because we spend a lot of time and effort in educating the patient as well as prescribing various drugs, and so we're giving the patients a huge amount of information. It's our responsibility, I think that's the change that we've realised, it's our responsibility to think about this in all aspects of what we do.
Now with the review that's occurred and we've just undertaken, has been an opportunity for us to check how well we're doing on that journey. We've had reviews of the actual consultation process, and we've had feedback on how that communication is occurring. So for us, it's just continuous quality improvement. How do we continue to enhance that in the future?
So as doctors, we're always trained to find out where the patient is and then work with them to help them create their own strategies for addressing a problem they might have. But there are two key things to that, I think, that are important and that were important to us as we went through the health literacy review, and we were able to improve on as we went through that process. The first thing that a patient needs to do to work on their problems that they have, to develop their goals and their strategies, is to learn about the problem at the beginning. Once they have that understanding, they fly. And if they can engage and create their own self-management goal, they're usually much more successful. To make that happen, to ensure that the patient can create their self-management goals, to ensure that they have the health literacy, the knowledge that they need about their condition, well, the team, the doctor, the nurse, the healthcare assistants, and even the administrative team all need to be on the same page. And we all need to improve our knowledge about how to present that information.
This whole process has pointed out some areas that we can do, certainly that we can improve on. I guess what have we learnt about it? We've learnt to just pull the system apart, have a really good look at it. We've been given some excellent tools to do that. But we know we're at the very beginning of what is a very long journey, because it has implications for all the services that we provide. So this is the start of something quite big. The process of being involved in the health literacy pilot program that we've just completed is going to be very valuable in terms of informing the way we implement the Diabetes Care Improvement Program. So the next step for us will be in introducing the learnings that we've had with health literacy into those individual practice plans at the pace that the practices are ready to do that.